going on, we know, out there around the internet as people try to do really unfortunate things, I think, around the COVID crisis. But before we go there, of course, we're going to start where we always do with Hawkeye giving us the rundown of how things are doing here in the hospital.
Yeah, good. Welcome back.
Hey, thanks. It's good. Yeah, Colorado's great. Had a great time.
You
a little
leaving?
Fishing, a little hiking.
Didn't make our numbers too much worse, so we've been really good.
I hope I'm not bringing anything back. I don't think I am.
No, that's right. I know you're practicing safe practices, best practices.
Work hard.
You know, we have been good. We did hit that recent peak of 24 about 10 days ago. Last week we were really down into the high teens. We continue to be in the high teens. We've had some discharges and some new admissions, but right today we have 18 patients in the hospital, but 8 of those in the ICU. So the other thing that's important with that is only 2 of those are on the vent. So we are really trying to avoid ventilator if you don't need the vent, and I think we're doing good with that, and we'll just kind of continue to see how our numbers go. We see the numbers every day in the media outlet about how they're just increasing, and hopefully we can keep the number of hospitalizations down as much as possible and keep everybody home.
And Dana, is it your sense that the therapies that we have are making a difference here in the hospital? Because I think about like remdesivir and tocilizumab and anticoagulation and steroids. It feels like we do better than we did initially in the crisis, even if you try to correct for age.
Yeah, I think that's right. You know, we have narrowed things down as much as possible now. You know, again, as the science and the clinical science changes, we continue to get better information. But I think the number one thing is we are trying to avoid putting somebody on the vent if they don't need it. Before, that was said to do as soon as possible. Now we're trying to just use high-flow face mask with oxygen. The other thing you mentioned before is the anticoagulation. We know that a lot of people, especially with severe disease, get small little blood clots in their lungs, which impairs gas exchange and blood flow, and so we are working to destroy those blood clots or treat the blood clots with anticoagulation. And then, of course, the antiviral things that we have. So the only direct antiviral is the remdesivir, and we are giving that out. We've been very fortunate with the federal allocation and working with the state as well to get those doses of remdesivir. But also the convalescent plasma. And we do have at least 2 trials going on other anti-inflammatory types of medications as well. So the trials are very helpful.
So would you say that patients do better today than they did at the beginning of the crisis? Because that's the sense I have, is that we do better overall.
Yeah. Again, we are seeing, even though you mentioned about the age, we are seeing a little bit younger patients in.
Right.
But I think all of those things combined, hopefully we are seeing better outcomes, especially with the severe disease.
Yeah, that's my sense.
And that's the main goal.
It's hard to know, as you said, the whole age population has changed so much, and so the disease has really shifted a lot in things. You know, a lot more evidence and discussion over the weekend about inequities and how people are doing with this. Clearly, if you're from an African American or a Latino background, you're more at risk. Yeah. A lot of that appears to be related to frontline healthcare workers or just frontline workers in general, and then having to live in more in tighter quarters when you go back home.
Right. Yeah, absolutely. And we are seeing that at the hospital, you know, anecdotally, and I think our numbers last week when we had kind of run down some demographics about saying we have in the ICU a person that's 29 up to 80, and on the floors, a person who's 24 up to 65. The other thing in that was exactly like you said, we had seen a preponderance of Hispanic people, and some of them, like you said, multi-generational housing. There was a patient who lived with the sister, the mother, the wife in the same household, and things of that nature. Certainly, the disparities are not going away. They just continue to expand, and we hopefully acknowledging them and then addressing them is the next step.
Well, we know that in general, healthcare crises tend to magnify disparities and not make them better. And once you get sick, you're sort of sick, and then you're here. But the chronic stress of being in more difficult living situation for whatever reason clearly takes its toll on all of us, and certainly for those who are perhaps impoverished or under the gun of discrimination on a regular basis. Sean, in your role as Vice President, VP, how about that one? The Vice President of Information Technology, You spend a lot of time trying to keep us safe. In this case, the safe is not from coronavirus, but from computer viruses and other types of phishing attacks. Talk to us a little bit about the risks that are going on out there right now around the coronavirus and around all the things we're seeing across the country.
So cybercrime's a crime of opportunity, right? So anytime there's something going on, there's always somebody out there trying to make a financial gain from it, and the coronavirus is no different. What we're seeing is an increase in COVID-19 and coronavirus-related emails, phishing emails, coming to individuals and to like small, medium-sized businesses, kind of targeting them. So it's out there, right? So what the bad guys are trying to do is, make a financial gain on something negative, and they kind of play on your heartstrings and try to take things from you, like your username and password. They're trying to put ransomware on your computer, and then they make money from that. So it's kind of a bad deal.
Great financial opportunities that look just terrific on the email, right? And then,
did you invest in that company? In
yeah, it's not worked out so well.
Yeah. It's still waiting on that check.
Yeah, I'm going to be waiting for a long time. So
exactly.
Fortunately, I've avoided that stuff because you figure out very young that people are always trying to take your money and do it in ways that may not be related to hard work. You have some guidance up here for phishing. Do you want to talk to us a little bit about that?
Yeah, so these are just some basic guidance on phishing. So, they send these emails to you, and they send them with authority, right? That there's someone official. I'm a bank, I'm a doctor, I'm a government, how many of us have received the email from the IRS? And it's like, they're just trying to play with you to try to get you to give away username and password, social security number, credit card number. They want that information. Or it's an urgent email, right? You have 24 hours to respond, or you're gonna go to jail, those kind of things. So you have to watch that. The one that I get this one like once a week is, my Amazon Prime membership is going to expire if I don't click on this link. And here in a minute, I'll show you how to watch for those kind of things and why I don't click on that. They go with your emotion. Is the message, does it make you feel panic or fearful? Cyber criminals often use threatening language and do that. And then scarcity. This is the one they're probably using mostly right now during the COVID-19, which is, get masked, there's cures for coronavirus, all those kind of things. And as you know from talking to
nobody's talking about cures for coronavirus because we don't really want anyone to know about that.
Right, yeah, it's a secret.
It's a secret, yeah. We only give it to a few people, the ones we really like.
Right, exactly. So here's an example of a phishing email, and playing on your heartstrings, right? Which is alert and this one, it's alert and health warning, with ... there. And then if you look at the email address I have circled underneath there, that meta.ua. It's a pretty questionable email. Or questionable web address. I went in and looked at it yesterday, and it's actually, I think it looks like it's in Russian possibly. And then there's a document attached to this, which is a little odd. And then another key tail sign of a phishing email is grammatical errors, right? And so it should be attached document, not attached document. So that's another example of, just kind of scanning through an email before you open a link. Look at those things. If it feels fishy, it probably is fishy. So this is a legitimate email, and I want to throw this one in here to show you that this is actually from the World Health Organization. That is their web address. And then if I didn't have a picture of it on here, but if you hover over the read on where the circle is right there, you would show you that it would go to who.int. So next slide, please. So this is an example of a fake email from the World Health Organization. And at the top, if you see where the address is, it is not from the World Health Organization. It is from some random address that should make you go, this doesn't seem right. How is this not from the World Health Organization? So that should be your first clue.
It's got the World Health Organization emblem up there.
Yeah, but you can go out and steal those logos. It takes like 2
minutes.
minutes to do that. It's a right-click save and put it into a web address. So it's not a big deal just because they have a logo in there.
Even technologically challenged people like myself can get that done.
And then if you hover over the link where it says review, you can see this really long URL address that doesn't tie back to the World Health Organization. If it's that long, it's a little random and it seems weird, and they're hoping to lose you in that. So that's another reason not to click on it. And then if you go down further of the third circle, you'll see that that address is also, it's WHO.com, which is not the World Health Organization. So another thing to remember with, to make things tougher on the bad guys on the is the passwords do and don'ts. So when you have passwords, and this is something we're really trying to educate our employees here at the University of Kansas Health System is, do use a combination of letters, numbers, and symbols with your password. Make it hard on them. Make it 12 characters. Use a passphrase instead of just a single word. One of the things you could use is like, Chiefs win the Super Bowl. Something long, and then mix in some zeros and some ones and some dollar signs in there. And it takes, for a 12-digit password, it takes something like 200 years for them to hack that, as opposed to an 8-digit, which is like 2 minutes. So it's a lot of difference there. Use different passwords to protect confidential information. What I mean by that is, if you have a bank password or your Amazon Prime account or a work account, use different passwords than you would for your Gmail or Yahoo account. It's just good password hygiene to do that. And then when you can, I know a lot of places now, especially banks, are using 2 factors. So it's something which is a password, and something you have, like your telephone, will send you a text message to approve that. And then the things you shouldn't do is, use username, password, address as your password. So don't do, if it's S. Roberts, don't use S. Roberts as your password. Use your email password for any other site, like I mentioned. Use a password again if it was breached. So if you're notified that your password was breached from like Yahoo or anything, never use that password again. Consider that password burned, because that's the first thing they're going to do, is folks have access to that information and they can try that password. And then don't use easily guessed passwords. And then this next slide is going to show you this is the top 12 easily guessed passwords. So as you can imagine, I'm sure many of you are looking through there going, oh, that's my password, or that's a portion of my password. It's because it's true. They can go through and guess your password, and this is what people do. So look at those and don't use those. And I know it's very tempting to use Royals and Chiefs and Jayhawks and Tigers, and don't. Because folks know where you went to school, and if you went to school at KU, they might guess that Steve Stite's password is Jayhawk. I don't know. We never know that.
It's Tiger, but there you go. Just kidding. Okay. Well, Sean, thank you very much. These are really important tips, because we know we're all getting this kind of stuff all the time, and you hope your spam filters take it out, but not always does it do that.
It doesn't catch everything.
And it's funny, even here on the COVID crisis, we caught a lot of folks trying to sell us fake masks or fake this or fake that, and you're like, really? Come on, this is a national healthcare crisis, and people are still out there trying to scam it, right?
See it all the time.
It is. It's a difficult thing.
You've had to deal with some significant false masks. And
we did, and oftentimes that would just happen to come available at 11 o'clock on a Friday night. Imagine that. And, oh, God, we got 500,000 N95, blah, blah, blah. You're like, wait a minute. And then you'd ask them for their FDA forms, and things started getting real sketchy real fast. And then a few days later, they call you back, and they say, well, that FDA form, I think we may have found it. Can we send it to you? Well, they just got a lot of turndowns, and other people didn't want them. Pretty soon, I got a warehouse full of masks, and I know so-and-so who knows so-and-so, they'll vouch for me. And you're like, oh, this didn't work out well at all. So fortunately, we did not pick up those masks. But we may have some media questions out there. Let's start asking first with our media colleagues if there's anything they want to inquire about. And the next question goes, Jess, you're batting for Jill today, so what's happening?
I will do my best. Okay, so Donna has a question. She says, good morning. My husband has a colleague that has symptoms, has tested positive. The clinic only asked her where she had been in the last 48 hours. Is that an adequate period of time for identifying contacts?
Boy, 48 hours, probably not quite long enough, because we know this can be asymptomatic for 5 or 7 days while you begin to get the symptoms of the virus.
Right. Yeah, you typically, from what we know, you are probably most infectious 1 to 2 days prior to any symptoms to 1 to 2 days after, and then your infectiousness decreases. However, for the purposes of contact tracing, whether out in the community or in a workplace, they typically use only 24 hours from when you had the last contact with somebody. Sometimes they will go out to 48 hours. That's just kind of convention that is being used as far as contact tracing. Because we understand, and we've talked about this before, even though Kansas is getting 400 new EPIs to help do the contact tracing, it still does take a lot of work. So typically for convention, for the most part, 24 to 48 hours after last contact is used in the context of contact tracing.
But you could easily miss some contacts in the
Yes.
time period, and that's the concern, of course. You know, Dana, it feels like with so many people positive out there, it's getting harder to do contact tracing and have it be an instrument of validity, so to speak. So talk a little bit about how do we do contact tracing. At one point we were 10% positive based on antibody testing. With the rapid increase in numbers locally as well as nationally, you just got to believe there's a ton of coronavirus out there.
Yeah, you know, I think that is the best way to move about it. And I know when I was traveling, I know when you're traveling, I know when I'm out in Kansas City, I just have to assume coronavirus is out there. And that's why it's important for the mask mandates, for everybody to be doing their own work, to be wearing the mask to protect it in case you don't have it, in case you are asymptomatic. So we know that it's out there, it's important. We know that this weekend there were probably large gatherings, things of that nature, people getting together, hopefully in a safe manner. But to your point, the virus is out there, and all we do keep seeing is that cases continue to increase. Now, luckily, and we are hopeful of this, that most all of these cases are going to be either asymptomatic or not have somebody have to go to the hospital and go to the ICU. But still, the fact is that there are those vulnerable populations, and we do see young people who have to be hospitalized. So just understand and go about your daily business, understanding that the virus is out there, and do those things to protect yourself and protect other people.
Yeah, and I do think, when I traveled at least, it was all about the mask wearing and hand washing and being outside the entire time. I mean, I do believe being outside makes all the difference. There was another thing that came out over the last few days. A number of scientists wrote a letter to the World Health Organization and said, gosh, is this airborne or is this droplet? And saying, well, we think it's more airborne. Then when they went to define airborne, it had a lot of droplet characteristics. I'm not sure. We sometimes get lost in this discussion of airborne and droplet. I think the key is that it's a respirable particle that's coming out from one person to another person. And then in large group gatherings, if you get a couple of people who have it, because if you think if there's 100 people together, there's probably between 5 and 10, or well, at least 5 people who probably have the disease actively, and they're going to be spreading it around. And so pretty soon there's going to be other people who get it, and unless you're outside, unless you're socially distanced, unless you have a mask on.
Yeah, absolutely. Again, further distances, 6 is okay, 8 is better, 10 is better, outside, things of that nature. Just understand, and again, go through your daily life. If you have to go places, understand that it's out there. And so, again, continue to do those things that we've talked about.
Yeah, makes all the difference.
Jean wanted to know, is it safe to eat food prepared by someone outside of your regular bubble if you're social distancing from them?
Yeah, can you eat food prepared by others? And I know for a while we were really concerned about food and contact surface and surfaces. That looks like it's playing less and less of a role in terms of viral transmission. So my sense is, you can kind of eat food unless somebody's actively sneezing on it or something.
Yeah, absolutely. And we haven't really, and because people have been getting takeout forever, now we have to assume the people that are preparing or serving or delivering our meals have had it, maybe, or do have it. But really, there has been no evidence of transmission through food. Now, I wouldn't use, again, communal, like spoons or spatulas if you're scooping out, say, mac and cheese or potatoes or anything. I wouldn't use the communal
buffets are
things.
still kind of like, not so good.
Right.
Right. And then I think, are the restaurant workers, do they wear masks? I remember going into some places and people weren't wearing a mask. I'm like, you have got to be kidding me. You're preparing food, you're going to hand it out, and you're not wearing a mask. So I walk out of that spot and go to the place where they are. So, Sean, have you guys been doing some takeout since? Because you and I were talking before we started the day. You've been working from home the entire time. And talk to us a little bit about that experience and how's it been doing that as an IT guy from home.
Yeah, it's been interesting, and we were lucky here because about 2 years ago we had many groups within the health system that went and started working from home. So we were probably more prepared than some places to
Right.
move, a large percentage of your workforce home. And it's different working from home, right? You feel very isolated, but by using Zoom and Teams and having video, it definitely helps us feel connected to our teams and to the hospital. And
Yeah.
I think just through watching you guys every morning, I watch your broadcast. And
I'm sorry for you about that.
no, but it's good though, because we feel really connected, and I know from us talking to our staff, they feel very connected to the hospital at home because we're doing things like this, and so
Yeah.
it's very much appreciated. Just
Yeah,
want
well-
you to know that. So
Well, thank you. It's all about Hawkeye, I think. I just I'm kind of goofy when I'm up here. So, have you guys been doing takeout?
We have.
Yeah, and
we have.
where do you have a favorite place?
No, just takeout in general.
Yeah.
I've gone to a couple of restaurants and sat outside. It's been very interesting, but in general, I think the restaurants have done a great job of everybody having masks on and taking the precautions they need to. So it's been good that way, and it's nice to get out and be around people, even though if you're social distance and sitting outside, it's
Yeah.
still great to
It's a
do
good
that.
feeling.
Yeah.
I was out, and you had gone to Colorado a few weeks ago. I was out there last week doing some fishing and hiking and just kind of being outside a lot. And the restaurants, by and large, it's interesting. The towns had blocked off the main streets,
Yeah.
and all the restaurant seating was out in the street. And the servers would bring out, they're all en masse, they would bring the food out in the street, and then they shut it off at 8.
Oh.
Because they were trying to make sure people were gone, and they didn't want the bars open later,
Right.
and so that way you couldn't have a lot. It just is a little bit different behavioral thing. So it's interesting how they had approached it, at least in the towns that I was in. I was in the
Yeah.
Glenwood and a little bit in Frisco.
And I would say, even in those situations, whether you're at somebody's house who, is in your bubble, whether you're at a restaurant, still the last thing you want to do after you prepare everything to eat is, again, do hand hygiene at that point as well. Either
Yeah.
hopefully have alcohol, sanitizer with you, or go wash your hands or something like that.
Yep. I'm rubbing your nose and then eating or touching. That's probably not the right
Right.
plan.
Yes,
Is that
correct.
against? Is that yeah?
Do not touch your face, not your eyes. I know
Yeah.
it's probably still some allergies going on out there, itchy eyes, runny nose, things of that nature, but try to avoid touching your face for sure.
That sounds like a good plan.
Couple of parent questions. And Dr. Stites, you had mentioned bars. Erica wants to know, she says, my daughter is being pressured by friends to get tested. She was at a bar in Lawrence that reported 2 cases. She is asymptomatic. She doesn't want to get tested. What do you recommend?
What do you think, Dana?
I think in this
Lawrence Bar, it's tough.
this is a question that has come up a lot this weekend though, with people that I know who have texted me because, as we said, it is out there, and I think it is going
it's
through
really
Kansas
out
City
there.
now in certain areas, certain groups. I think the hard thing that we have been doing is to say, okay, you may have been around this person in what manner, you may have been at this place. Really, there still are some testing capacity issues. For the most part, we've overcome them. But it's still going to require the quarantine if you are designated a contact. And testing really doesn't test to get you out of quarantine, because we understand that test is really good for that time period, that time point, maybe 1, maybe 2 days after, but after that you still have to continue to monitor for symptoms for the next however many days to complete that 14-day quarantine or symptom monitoring time frame. So I wouldn't test just to go get tested. You have to continue to do the responsible thing about quarantining or isolation if you're a case. But unless you develop symptoms right now, as it stands, probably testing is not a good idea, because
Yeah.
you could be negative and then 2 or 3 days later have
Be
symptoms.
positive, especially if it was a recent
that's the
exposure.
issue.
I think
Yeah.
what we would say here at work is, you're isolated. If you've been around
Yeah.
and you think you had a contact, then you have to be quarantined, self-quarantined for 14 days.
You're right.
And I think that's what I would say to this young person. If you've been in a bar and you think you may have been around a contact and you weren't, wearing a mask, social, all those things we know that are important behaviors, then you probably have to be quarantined for 14 days and self-quarantined
Yeah.
for 14 days. After 7 days, you can get a test. If that test is negative, it's probably about 75% certain. And at 10 days, it's closer to 85 or 90. At 12 days, it's about 99%. And at 10, 14 days, it's pretty close to 100%. But the point is that the longer you wait to get tested, the more likely the test is to have picked up whether you actually got exposed and had COVID-19. The trick to this is, and I think that there's an important message with this. You can look across the country and see areas that are under greater stress. Look at Houston, Texas. There's articles like, it's not as bad as New York, but it's approaching New York because they've pushed their medical systems to the point of exhaustion and people are starting to get sick and it's bad. And the reason is that they accelerated so fast. the things that all these techniques are going to do, since we're not sheltering in place anymore, is there's going to be more disease, right? When we sheltered in place, we bent the dadgum curve, clearly. Without sheltering in place, we're not going to bend it like that.
Right.
What we need to do, though, is keep the rate of growth at a level that can be tolerated by the healthcare delivery systems and make sure that we can keep things going. That's really, I think, the trade-off that we were doing. We're not going to shelter, get that. We've got to reopen the economy, get that. Your behaviors as a community, as a citizen, are going to dictate how well we do. And really what you don't want to be is you don't want to be Houston, you don't want to be New York, and you do that by trying to maintain as much infection control stuff as you can. And if you do that, you can really continue to bend the curve.
Yep.
If you don't, things escalate and then we all get into trouble.
And that being said, if we had the testing capacity, if we had the supplies, if we had a timely test that's accurate, say less than a day, and it was available at either walk-in clinics or other clinics, that might be something that you could do, every 1 or 2 days, just as you would go to a clinic to get an accurate influenza test. But right now, our testing infrastructure in the United States, either locally in communities or throughout the United States, is not there. But that is something to move forward to in the future. And if people can go to these other places and get these either saliva tests, or if they can get an antigen test, something that's freely available, that is accurate, and that doesn't have a long turnaround time.
And when you say freely available, you don't mean economically.
Not for free,
it's just readily available.
Readily available,
but it's
yes.
not free.
Yep.
And to say the salival testing is looking better and better.
It is
and
looking
so I
better.
think we're going to be we're on the verge of salival testing across the country right now, and that's going to be a bit of a game changer. Hopefully available within the next 1 to 2 weeks here in Kansas City, I think.
Because the caveat is, I had a family who contacted me on Friday because they were driving to Denver, and a person in the car got ill with acute symptoms. They got a test in Denver, but that test is not coming back for 3 or 5 days. So
Right.
again, something that's accurate.
I mean, you just have to isolate for the next 3 to 5 days so you get the darn thing back.
Yeah.
Yeah, that's tough.
So on the topic of testing, Nancy says that she read that the PCR test cannot distinguish between live virus or non-infective RNA, such as cold, measles, Ebola, et cetera. Is that
I think
true?
there's probably a mix of different concepts in there, and let's go ahead and straighten that out, because the PCR absolutely can detect SARS-CoV-2, and the testing distinguishes SARS-CoV-2 from all those others. Yeah. Now, if you're just looking for messenger or looking for RNA particles and on a countertop, that could be a little bit of a different question.
Yeah, absolutely. And this is a lot of the references that we have seen where they detect SARS-CoV-2 for 90 or 100 days after infection. That's one of the biggest questions in medicine right now is, does detecting the virus on the PCR test mean that the virus is actually not live, but we say live or infectious? Can it cause infection? Or is it just fragments of the RNA or the genomic material? And that's the big question that we are trying to answer. We don't have a lot of good data, but we have some data to suggest, again, you are probably most infectious with infectious virus 1 to 2 days prior, even though we can detect it further out, which you could still be a little bit infectious, and then 1 to 2 days after symptoms start. After that, the viral load tends to go down for the most part, and the ability to culture live or infectious virus decreases 1 day, essentially 1 day at a time, to when you get to about 11 days, at least from the upper respiratory tract, they haven't been really able to culture infectious virus. But again, that's a large question that's trying to be answered around the world. So there is a difference between detecting just the virus with the PCR test and is that virus live or infectious. And so hopefully as we move forward, we'll be able to answer that question.
I think it's interesting when you look at all the stuff that's going on about how do we detect a virus, how do we not detect a virus, is the virus changing? Mm-hmm. It is interesting to me that our population, I think we just don't know the answer to this question, but as so many more people and you can see the graphs every day, number of people that are going every day, it's 50,000 new cases a day across the country, some crazily high number.
Yeah.
And then you look at the number of deaths, they're continuing to fall.
Yeah.
So you ask yourself, is the virus really becoming less severe, or is it just because we're in a younger, healthier population? And I don't think we're going to know the answer to that for a long time, actually, because it's just hard to know. I did see one thing over the weekend that suggested that that there may be part of the Neanderthal genome, 6 genes that are in certain people that may make them more susceptible. My wife probably thinks I have those 6 genes. I'm pretty sure that she does.
Right.
Yeah, maybe several on both strands of DNA. And so there are all these things we're still trying to study. And then the other thing was this ABO stuff.
Yeah.
You know, are you blood type A, B, O, whatever. And now that's beginning to look like, oh, no, that was an overcall. That's not really true. And so maybe it is the Neanderthal genes that are stuck with us that are causing trouble. I don't know.
Yeah, some of us have more of those than others.
Some of us do, I'm pretty sure.
But I think that's interesting. And I think that plays into the overall technology that we have today compared to 30, 40 years ago. With being able to do these large, high throughput or genome sequencing, looking at all those, the genomes of humans, the genomes of the virus, things of that nature, we will continue to get better data, more data, and then assimilate all that to really get a better picture. And certainly, as we've talked about, what we know 2 weeks from now is going to be a lot more than we know right now. What we know 2 months from now will be a lot more than we know right now.
Yeah, it is a funny time.
One last quick testing question. Cheryl wanted to know, if you don't get a doctor's recommendation to get a test, where can you go get a test? Her daughter has a reoccurring fever, but the doctor hasn't said that she needs a test. Where should she go?
I don't know that, other than I've heard of 2 places, maybe Quest or CVS. I'm sure there are other commercially available tests that you can walk into.
I think I Google the question.
And I don't even know the details of those 2 places.
Yeah. And I think you'd have to find somebody who's going to say, you can't just say I want a test and get one. You have to go someplace where somebody's going to order up the test. So I think CVS does have some. They have about at least a week 5 to 7 day turnaround. And most places are going to want you to do it. The other thing you could do is call your primary care provider and say, hey, I think we really should be tested. What do you think? And just ask them to order a test for you. So those are other ways. The county health departments sometimes have drive-up clinics and drive-through clinics that you can go to as well. I know that we have some, but ours require an order. But I think that Wyandotte County, I know, has some clinics you can go to. So it's different, I think, from county to county.
And I think Truman, when they were on
They have
CMO, they were doing
yeah.
some very good outreach. And I don't know if they're still doing those, but yeah.
Okay, we have a media question that just came in from our friends over at KSHB. What is the risk right now of people going on vacation as we see these numbers start to rise?
You know, I think you have to be very smart about how you do it. So I just came back from Colorado. I think we were smart. We drove out there. We drove back. We took all the precautions. We washed our hands. I had sanitizer in my car, wore my mask anytime I got out of the car. And I think we played it really safe. And then when we were on vacation, we actually stayed in a hotel room, but we either made our own breakfasts or we would order a breakfast and bring it back to the room or sit outside and eat. We never sat inside a restaurant to eat, really. And then when we were going out on a hike or we were on a river, we just eat dinner on something there on the river and have a nice time. And so I think you can be safe when you travel. I think the thing you don't want to do is say, let's go on a plane flight that's crowded, not wear a mask, not sanitize, not wipe down the area, then get somewhere and go into big crowds. I think it's all about your behavior. The reality is you can be just as exposed going to the local grocery store here in Kansas City as you can be by traveling. There's no magic badness about traveling. It doesn't suddenly become evil because you got in your car. What happens is, what is your behavior? That's the question, I think. Don't you, Dana?
Yeah, absolutely. I think it's certainly more dangerous to fly on July 6th than it was on June 6th for everything that you've mentioned about. People are traveling more. People are opening up more, going places. But there's more virus spread as well. So I think taking all of that into account is very important.
Yeah, all those things make a difference. Sean, do you guys travel anywhere this summer?
We have plans to go to Florida in a couple weeks, and so we're looking at alternate plans to go to Colorado.
Yeah,
so
good.
Colorado. So
KDHE
has done a really nice job of pushing out there what states they are saying are, if you return from that state, you have to quarantine just because they have a higher incidence. And what they've said is, if it's like 3 times higher than Kansas's, then they're going to consider that a higher risk than being in Kansas, where here's your level of risk if you're in Kansas or Missouri. It's the same story.
Right.
And then, and so if you go to a place where the rate of infection is 3 times higher than it is in Kansas, they consider that a higher risk, and therefore when you come back, you should be quarantining. Florida is one of those states now, so it's harder to go there. Colorado is less than Kansas, and so a better place to go. And they're still accepting people from Kansas so far in Colorado. At least they didn't stop me at the state line.
Right.
I snuck through in the middle of the night.
Specifically, a follow-up question from that reporter about traveling. Wanted to know, Dr. Hawkinson, what specifically you did to stay safe while you were on vacation.
Yeah, again, we drove to one place and we flew to one place. I think flying is much different now than it was, but I think in the airport there are a lot of people in a small area. I think face masks are absolutely needed. In the airport, if you are waiting in a line, distance 6, 8, 10 feet. If you are waiting for your plane, distance 6, 8, 10 feet. When you get into the plane, and again, this can be for a train station or a bus station as well. You are in a small confined area for multiple hours, 1, 2, 3, 4 hours at a time. When you are actually doing the traveling, I think face mask is absolutely needed. You obviously can't distance in that area. Eye protection is essential as well. These are not sunglasses or eyeglasses, but more of safety glasses. You can buy them at a hardware store. You can buy them on Amazon. Traveling with your own hand sanitizer and really trying to avoid touching your face and things of that nature. Basically the things that we've been continuing to talk about, but now we are getting to see more people clustered together in airports, in planes. Things are booking up and filling up, and so that's really the main danger.
Yeah, I think you can travel safely.
Yeah.
I did see that American Airlines, for example, said they're no longer going to reserve the middle seats and keep them open. And I thought, wow, what? But other airlines are trying to do that to keep people a little further apart, which I think is just safer. I struggle with air travel right now, to be honest with you. I think you can make it safe, unless you're on a really crowded plane. Even then, I think you're going to defeat your PPE.
Or face shields.
It is.
I
You
did
can
see
ask.
people wearing face shields.
And you
as
can
well.
check when you make the reservations whether or not they're trying to sell at the planes. And I do know that some plane, I think even American was saying, if you're uncomfortable, you can schedule to a less crowded flight. And so it's hard.
So Tammy wants to know, what is your opinion on the Kansas governor mask mandate and the county commissioners that have gone against that?
We try to stay in our lane. Our lane is healthcare, and that's a political question. And so here's how I'm going to answer it. We know absolutely that wearing a mask keeps you safer than not wearing a mask. It's just otherwise, when you went and have your surgery done, the surgeons wouldn't wear a mask. But everybody in the operating room wears a mask. And why is that? They're trying to not give you an infection. So why would it be any different in the midst of a pandemic? Why would you think that masks don't protect you? Now, masks have become politicized, and that's just wrong, because it's putting people's lives at risk to do that. I do get, if you're in a county with virtually no coronavirus that you know of, and see, that's the key, that you know of, you may say, gosh, do I really need to wear a mask? But really now, corona's everywhere. And if you think that it's not in your county, probably what the answer is, you just don't know it yet. And then it's just a question of how do you stay safe? And there is just no way around it. You are safer when you wear a mask out in public than when you're not, unless you can maintain a lot of social distancing. Here's the story. I was on Loose Park this morning. I walk the dog about 6 a.m. every day. My wife and I do. You know what? I didn't have a mask on. If I saw another person, I walked a good 20 or 30 feet around them into the grass, back on the walking trail, because I'm going to keep that person safe. I'm going to keep myself safe. Now, yesterday, I was out running some errands. Had to go to the hardware store, had to go to the grocery store, I had to go down to the storage unit, I had to go to different places. Guess what? I had a mask on every time I got out of my car because I couldn't socially distance successfully. That's really the answer. And so I think that from a healthcare perspective, there is no debate. Wearing a mask makes you safer than not.
Yeah, absolutely. I think, hopefully, we are a source of truth. It's down to everybody to find their source of truth. The main sources of truth we use are CDC, World Health Organization, the KDHE websites. Those all provide great information. There was a publication at the middle of last week on one of the CDC's journals, Emerging Infectious Disease, and their final conclusion was that things to do to reduce the risk of spread of this disease is physical distancing and universal masking. And so find your source of truth, understand what that is, and go with that and really try to adhere to that. And if you have the CDC saying we need to be universal masking to really decrease the spread and stop the spread, that's a pretty good source of truth.
Well, I think there's medical evidence and there's political thought, right? And what we're giving you is the medical evidence. You elect your other folks to go out and have political thought and political discourse, and that's great. But really, we're going to give you medical evidence. And there's, again, you wouldn't want your surgeon sneezing into your open wound, right? That's just wrong. So it's you know, there again, I come back to, there is no question that wearing a mask in a crowded place keeps other people safe and helps make you safer too. Not wearing a mask in a crowded place is an invitation to spreading coronavirus. Simple.
Linda had a question about our health system specifically. She had some concerns and some questions about if we are doing it right, taking temperatures, asking the right questions, directing traffic properly. She was really concerned about making sure we're doing it safe. Can you make her feel better about that and what we're doing specifically?
I think we can, Dana. You take the first crack at this.
Yeah, absolutely. You know, since day one, we have continued to evaluate our processes. We've had processes in place, but those continue to evolve. Those are, again, based on the best evidence that we have. They continue to change. We do have screening protocols in place. We have universal testing of all of our outpatient surgeries, of all of our inpatient admissions, whether you have symptoms of coronavirus or not. And this is all to protect our patients and all to protect our healthcare workers as well, really anybody coming into the facility. And I think we've done a good job of that. We have found, on average, at least one or more patients who had no symptoms of COVID when they were admitted to the hospital, just on our screening when they were admitted. And so I think that protected other patients as well as other healthcare workers because we were able to get them into the right place, into the right area, and treat them accordingly.
Sean, does your team feel safe when they work here?
Very, very much so. We early on distanced our team. So we definitely have team members that work, at the help desk and work here every day and 24/7. What we've done is separate the teams into pods, right? So they're not together. Even we have teams at a warehouse. Mm-hmm. We've separated those folks into pods. And they wear masks, and they feel very safe. And we've actually surveyed our staff, and they've said that. Actually, last week, we did learn that, unfortunately, one of our employees got not diagnosed, but it was around a family member who had it, and that person's working from home now. Yeah. But the good news is that because they wore a mask, and because they were social distancing, and the way we set up their work environment, they didn't put a risk towards the other employees, and so that's super important.
Yeah, I think it really is. And remember that we closed our surgeries down before we needed to, right? We did it right or to make sure we could have capacity for the public. And a few weeks ago, last week even, there was a debate: should we close surgeries again because of the rising number of cases? We didn't, because our hospitalizations aren't increasing, and it's just acting so differently now, and probably again a younger population, but it's different, and so. I do think that we work to keep each other safe because that's our job, and we work to make sure that you stay safe. And you say, well, you don't have a mask on right now, right? Because we're 7 feet apart. We measure this every day, or not really. We've measured it multiple times to make sure that where we are in this table. When we walk out of this room, we all have masks on, right? My mask's sitting right here. I'm going to put it on. I'm going to go make rounds this morning on my cystic fibrosis patients, and I'll have a mask on. I'll have my goggles on, and when I go into rooms, I'll have gowns and gloves on. I mean, we really work hard at this because we want to keep patients safe. And I think we've really done a really good job of that. And I think all the hospitals in Kansas City are all trying hard. Yep. We have that chief medical officer call. It's amazing how lockstep everybody is about what they're doing to keep folks safe. And so I think that we can say that we are doing, I think, really, really the top-notch work in doing that. Nothing is ever perfect, but I'll tell you what, I think from an infection control standpoint, hospitals are, even in the midst of a COVID pandemic, are safer today than they were before, because we are being even more vigilant about infection control from taking all infections in general. I think we're being more vigilant than we ever have been.
Yeah, I was talking.
And by the way, our data would prove that in terms of hospital-acquired infections.
Right, and I was talking to a CRNA yesterday who they are in anesthesia, and they are in the operating rooms, for those of you who don't know. And they are doing the most risky procedures all day, every day, with intubating people, extubating them after surgery. And that person said that they feel safe in what they're doing here at the hospital and all the protocols. And it is running and has continued to run much better even after the reopening. So we are continuing to evolve those and really just do the best practices in keeping everyone safe.
Yeah. Time for one more question, Jess.
Okay. Well, I had a good one, so let me ask this one if you don't mind. So Stephanie asked, she says, my daughter, she's a teenager, she plays an outdoor sport. A teammate tested positive for COVID. The coach is still holding optional practices. I'm keeping her home for 2 weeks since the exposure, since it passed. But how long should she wait to go back to practice after those 2 weeks, given the other players are still practicing while she's keeping her daughter home?
Yeah.
Wow, this is a hard one, Dana.
I know, it's very difficult.
You picked out the hardest question of the day for the last
I had to
one.
ask.
Well
I thought
done.
the good parent question.
That was good.
So basically, the daughter is a possible contact. We have to understand what was their role of contact, how long was it? It was outdoors. So I would hope that maybe it's a low risk contact, but I think if there's no other symptoms from your daughter, probably going back to practice at that 2 week mark is going to be okay, provided these are outdoor practices, outdoor games. You can instruct your daughter to really try to maintain that physical distance once she's back at practice, 6, 8, 10 feet or more from other people. I think in doing those things, they may be safe, just from what the details I've gotten from that question.
Yeah, hopefully it's not outside mud wrestling, because that would probably be worse if you were just doing something like that. But if it's soccer, tennis, I think that makes it a lot different, because you are moving around a lot and you're really not right in front of somebody for a prolonged period of time, and you're outside, so it's probably safer than if you're not. And my only comment is you're just going to have to assume that the COVID is out there on stuff like this. And if you're comfortable, and I'm not, that's not a criticism at all. If you're comfortable with taking on that risk, then you're going to have to assume your kids are going to be around people who are going to be positive. And so the key is when they're at practice, and hopefully the coaches are good about this, if you're going to have the team's going to huddle together, they ought to have masks on. But other than that, when they're out running around the field, I'm thinking about soccer in my head, then you're probably pretty protected because you are outside. And that's a risk you're going to have to take if you're going to engage in any sort of outside activity or outside sports. And waiting 2 weeks is certainly good, but the reality is that when you go back, it's going to be out there. And if it's not there, it's what the team you're going to be playing against. And so I think you just have to make that assumption. And the goal is to try and stay as safe as possible while engaging in that youth sport. So, folks, this has been just a great session. Sean, final thoughts today about phishing with a P-H-I-S-I-H, however you spell that.
Keep your password safe. Don't share your password with anybody. Don't give it via email. Don't give credit card information via email. Use strong passwords, 12 digits or more, characters, symbols, uppercase, lowercase. Don't use the same password at different sites. Would be another important thing to do. Watch for misspelled words, and if you're not expecting an email from somebody, don't click on a link. I know they put links in those. They make it so enticing for you to click on those links. Don't do it. If you don't know the person and they sent you a file or a link, stay away from it. Just delete it. If it's important, they'll email you again.
Thank you, and such great advice. And I have to constantly remind myself of that.
Everybody
too.
does.
It gets harder and harder. They get smarter and smarter about what they do. Dana, thoughts today?
Yeah, as we are moving into the post 4th of July era now, And Kansas City, with some of the masking regulations, wear your mask. For the most part, it's going to be for a short period of time, 10 to 20 minutes. It's not going to impair gas exchange. The majority of the population are going to be able to wear it. Use your hand hygiene. All of these will hopefully make a dent in the spread of the virus and really decrease the virus as we move forward, because now we are getting into the time where we have to think about schools reopening, athletics restarting, things of all that nature. And that is going to be very important moving forward within the next 4 weeks.
Yeah, and we saw what happened. A
Yeah.
number of the KU football players did test positive, and some of the strength and conditioning coaches and others, and as reported this weekend, they're going to stop practice for a couple of weeks until they can restart and retest everybody. Folks, it's great to be back. Had a wonderful time on a vacation. But as we come back, we see all the coronavirus out there. We know that we have what to do to stay safe. We know the things we can do to keep ourselves and our family safe. Doesn't eliminate the risk, sure makes it a lot better. Pulled in the driveway, unpacked the car, got upstairs, went to bed in my own house, and I remembered, folks, no matter where you go, there's still no place at home. There's still no place like home. We'll see you tomorrow.